It's Monday Rounds with Dr. Lauren Streicher. Today we're here to save our bones, right?
Save our bones and prevent them from becoming bad.
And of course the name for this, osteoporosis.
Osteoporosis.
Tell us exactly what it is.
Well, osteoporosis is basically low bone density. Throughout our life, we build bone and we lose bone. But the problem is if you lose too much bone, then your bones become breakable. You can fracture them, which is quite serious. And I brought some bone with to show you what I'm talking about. This is normal bone. And all bone has some holes here, and you're building it up, you're breaking it down. But this is strong. If I threw this on the ground, nothing would happen. Okay. With osteoporosis, you lose more bone than you build. And you can see that there's all these holes here. And if someone has a bone that looks like this, and they fall down, it's going to break easily. And what's so interesting about osteoporosis is, did you know that 90% of people that have a fracture from osteoporosis happens from a standing up position? This is not that they're getting thrown off a building and they break a bone. This is someone who is standing up, they fall down, and they fracture a hip.
Wow.
So this is a serious condition.
How common is it?
Really common.
I think we tend to think, oh, it's an old person's disease.
You know, that the problem is that people don't know they have osteoporosis because there are no symptoms. Your bones don't hurt. You have no idea unless you break a bone. And right now, there are about 44 million men and women, it's not just the women, who have osteoporosis in this country. And you know that there are about 9 million fractures every year strictly as a result of osteoporosis. And you know, when people think of fracture, they think, okay, so you have some pain, so you're immobilized. But this is serious stuff, and up to 25% of people that have a fracture die as a result of the fracture from complications. So this is an enormous problem. But there's so much you can do to either prevent it or even reverse some of these changes. If you have bones that look like this, it doesn't mean that you can't
get them back like this?
Back like
this. So you can reverse it.
There's a lot that you can do that's going to build up bone and that's going to decrease your fracture risk.
Okay, that's very important. We have somebody on Facebook who has a question for you, Dr. Lauren.
Yeah, Sandy Haynes asked, how much does hereditary factors into one getting osteoporosis?
Family history is certainly one of the risk factors. And we do know that if your mother had a fracture, if your grandmother had a fracture, that you may be at risk as well. But I always say you can't pick your relatives, but you can certainly change a lot of other behavioral things. So it's not just about hereditary. There's a lot of other risk factors. I always say that the osteoporosis poster child is the skinny, blonde-haired, blue-eyed smoker. And this is the only time you'll ever hear me say this. This is the only bad thing about being thin, is that if you are very thin, you do have a greater risk of osteoporosis, but of course you can reverse. It's better to be thin and do all the other things like cut down on your alcohol intake, don't smoke, exercise. We're going to talk a little bit more about
when you talk about things about preventing it.
Calcium is very important.
Okay.
You got to make your kids drink milk. I don't care if they hate it or not. They have to drink milk because one of the things we find is it's not just about bone loss later. A lot of people never get to their normal bone density because they did not drink milk growing up.
Early on. So that really is important.
So drink milk as kids, take your vitamin D, take your calcium, don't smoke, don't drink, and exercise. And even if you have a family history, you can sometimes prevent those changes from occurring.
And I think what's important is, I mean, if you're already, past the early years and you can't get the milk in you, you have to do what you can do now, which is a perfect time to...
Well, the other thing also is that I think a lot of people are aware that osteoporosis is a problem after menopause, and the reason is because estrogen is protective. So when women lose their estrogen, they also lose bone, which is why some women who take estrogen don't have that problem.
Well, joining us is a man who has trained Hugh Jackman, Diane Sawyer, and Gail King. Let's get on over there and go to them.
I'm just saying.
And you, right? and Dr. Lauren Streicher, and he's here actually to give us some clues as to how to build up our bones. So we want to welcome Jim Karras. Good morning, Jim.
Good to meet you.
Good to meet you, too. And you've been working with this young lady who's hot enough.
She looks spectacular, the new bride.
Yeah,
right, and
I just got married. And
she got married this weekend. Congratulations.
It was an emergency thing. I called him a month ago and I said, oh my God, I have arm jiggle. And he got rid of the arm jiggle.
We got rid of it right there. So what we want to show you today is really about building bone density through two things. It's weight-bearing exercise. And people talk about walking, which is fine, but it's not enough. That's what you and I always talk about.
Walking is great for the hips, but the spine is another vulnerable area.
Absolutely.
And patients always say to me, I don't know what to do about my spine.
And this is something right here. I want you to step on that. This is a shoulder press that I'm going to show you two ways.
And these are things that people can do at home.
Absolutely.
To make sure their bones are strong.
Absolutely correct. So right here, shoulder press. Lauren has the bands. Right here, Val, you have the free weights. Very slowly for me. Exhale and press up 3 counts, get that full extension, ladies.
Okay.
Slowly back down and pause right here. Exhale, press straight up right here.
This is actually helping the spine. I would think this is an arm.
Load your spine, Val. Great point right there. And I like that it's slow. And another thing, ladies, don't be surprised. Heavy weights is where it's at. Lauren, I'll take this for you.
So
you
does that mean less repetitions?
Less repetitions,
okay.
Exactly. About 10 repetitions, and you want it to be heavy. That's what's going to give you maximum bone density build. People all the time are talking about lots of reps with low weights. I strongly disagree. And also, ladies, to get your metabolism up, you want to get your muscle up. That goes hand in hand. So these exercises are also going to help. Out to your side, Lauren, out to your side.
I just have to add in, one of the reasons that people break their bones isn't because their bones are fragile, it's because they fall down. You have to fall. So balance is another thing that you get from exercise.
So like doing this kills two birds with one stone.
Can I tell you one other thing? I'm going to make Lauren do it. Do it on one leg, Lauren. Right here.
Oh, you
if you want to really, yes, I know. This is right here.
Listen, and you know what? I want to get. We're running out of time, but show me the jumping jacks exercise for it.
Jumping and right here, Lauren. I love jumping straight up from a squat position. Come on down together.
And what is it going to do?
Really load the spine. When you hit, tremendous amount of impact on the bone, which almost forces it to build. It's one of the catalysts.
Fancy to do
you
that.
don't at all. You don't at all. It works.
You can do it while
3
you're
times
watching.
a week for 30 minutes. That's all you need.
You can do it while you're watching Windy City Live.
Yes,
Thanks
you can.
so much,
Thanks
Dr. Lauren Streicher. Congratulations on your new marriage. And for these exercises, go to our website for all the information. Now, finding a job can be rough. Up next, we're talking with a career coach with some tips to land you a new gig. So stay tuned for that. Good stuff. Yeah.